Hello everybody, welcome back. If you haven't been here before, my name is Carissa Conrad. I'm a doctor of physical therapy and a therapeutic pain specialist, and I am the vagus nerve PT. What I thought I would do today is talk about a couple of research articles that I found that are really interesting about using vagus nerve stimulation to help treat headaches, in particular migraines. So there were so many research studies on this topic. It was difficult to choose, but I found a couple that I thought were really interesting. So this article is an observational study. This is entitled Cervical Non-Invasive Vagus Nerve Stimulation for Preventative and Acute Treatment of Episodic and Chronic Migraine and Migraine-Associated Sleep Disturbance. So in this study, they looked at patients with both episodic and chronic migraine and evaluated the impact of vagus nerve stimulation on sleep disturbance, disability, and depressive symptoms. So they had 20 patients involved in this study, and they were enrolled in a 3-month observational study. They did vagus nerve stimulation twice daily at specified times, and also used it acutely as an adjunctive therapy for migraine attacks. So this means that they were doing prophylactically twice a day vagus nerve stimulation throughout the study, and that anytime the individual experienced a migraine, they would also use vagus nerve stimulation in an attempt to treat the migraine symptoms. And they looked at pain intensity, number of headache days per month, number of migraine attacks per month, and number of acutely treated attacks and time to achieve pain relief. They looked at sleep quality and a couple of standardized assessments looking at disability and depressive symptoms. What they found is that the prophylactic use of the vagus nerve stimulation was associated with a significant overall reduction in pain intensity. So the average score at baseline was 7.75 on a scale of 0 to 10, and at 3 months, the average score was 4.05. So that's that pain scale when the doctor asks you, what's your pain on a scale of 0 to 10? They also found that they had a lowered number of headache days per month. So at baseline, 14.7, at the 3-month, 8.9. So that's almost half the number of days of experiencing a headache at the end of the study. And the number of migraine attacks per month at baseline was 7.3, and at the end of the 3 months, 4.45 attacks. So really, really cool research here. For acutely treated migraine attacks, so when they have the migraine and they're using the vagus nerve stimulation to treat it, what they found was a reduction in the average length of the migraine in terms of how long it took for the pain relief to take place. So at baseline, this was 84 minutes. And at the end of the 3-month study, the average length of time it took for the migraine to pass was 52 minutes. Really cool. They also saw significant improvements in depression scores and improvements in sleep. So very cool study here on using vagus nerve stimulation for treatment of migraine. This other study I found, this is cool. Can you see? So this one, transcutaneous auricular vagus nerve stimulation for migraine, an fMRI study. So an fMRI is a functional MRI. This is where they're looking at the brain to see what a device may have an effect on, how the device may have an effect on the brain. So what this talks about is dysfunction of the thalamocortical connectivity network is thought to underlie the pathophysiology of a migraine. So this study wanted to look at the thalamocortical connectivity changes over a course of 4 weeks of using transcutaneous vagus nerve stimulation, which is the style that I usually use, transcutaneous through the ear on patients with migraine. So this study looked at 70 patients with migraine. They were randomized in an equal ratio to receive either real vagus nerve stimulation or sham again. So sham meaning it appeared to be vagus nerve stimulation, but it was not truly stimulating the vagus nerve. They looked at a resting state functional MRI before and after the treatment. And they found that of the 59 patients who finished the study, Those in the group that actually received the vagus nerve stimulation had significantly reduced number of migraine days, reduced pain intensity, and reduced migraine attack times after 4 weeks versus the sham group. And the functional connectivity analysis revealed that the vagus nerve stimulation can increase the connectivity between the motor-related thalamus subregion and the anterior cingulate cortex / medial prefrontal cortex, and decrease the connectivity between the occipital cortex-related thalamus subregion and post-central gyrus / precuneus. Excuse me. So essentially what that means is that doing the vagus nerve stimulation modulates the thalamocortical circuits in patients with migraine. So it's actually treating what they think the underlying cause of the migraine is within the brain. It's actually causing changes in the brain, which is super exciting, as well as decreasing patients' symptoms and improving quality of life overall. So some really cool articles. This is the kind of content I want to get out for you guys. Just looking at these articles, this is just me pulling these up on PubMed, reading through, finding ones that are quality articles, quality research studies, and sharing them with you. So let me know if you like this video. If you want to see more content like this, subscribe, and I look forward to more videos in the future. We'll see you next time.